Assalamu alaikum wa rahmatullahi wa barakatuh, my dear brothers, sisters, viewers, friends of Iqra TV. Welcome to part 2 of Real Talk. Today we've been talking about health and the role of the Integrated Care Board that it plays in our day-to-day lives, particularly the West Yorkshire Integrated Care Board. And I have here today Fatima because nobody's the other way around for me, who's here from the Integrated Care Board to tell us more about what is the board all about, what does it do, what's its function, and how does it touch our day-to-day lives. So we've been talking about the various areas of health that they cover, but one of the most important areas for the ICB, in short, is that they need to be mindful of the needs of the public that they want to serve, and they need to make sure that the service that they develop reflect the needs of the people. Now, I was looking at your sort of structure of the care board, ICB board, and I was looking at the sort of directors and the non-executive directors. And I could only find one who was Majid Hussain, was a non-executive director. There was only one board member who was an African Caribbean person, or looks like an African. I'm not sure, I might be doing a disservice. And the partner members that you have, which is a number of other organizations, there was none from the sort of non-white community. And in participants that you have, these are the 3 or 4 tiers of the senior management sort of structure, and there's only yourself, your good self. Now,
so can I just clarify?
Yeah, is that still the case, or is that changed?
No, so it's not the case. So the way in which the Integrated Care Board is formed is based on both nominations and executive and non-executive leadership. So in the executive leadership, we've just appointed our Chief Information Data Officer, who is a person of an ethnically diverse heritage. We've also got another independent non-executive member called Anurangsu Chatterjee. He's been there for ever since we were created, the ICB. So we have 2 non-executives of ethnically diverse heritage. We've got the Therese Patton, who I think you were referring to, who is the representative from Bradford. And we've also got other people that work within the organisations that get to influence the work we do as well. So, for example,
now these are the people who make the policy decisions, I presume, on how is the organisation going to be run, what is going to be focused, how we're going to manage it, etc. Now, obviously, you've said there are 3 or 4 people there. Now, how important is their input into these policies? Because by being a non-executive director, for example, obviously you play a very important role.
Yes.
I don't know how many, I failed to see, actually my fault, how many non-executive directors there are on the board.
But we're just about to recruit another one, so there's a great opportunity for Iqra TV watchers to apply for the latest vacancy.
There you go, if anybody's interested.
Absolutely. I mean, the thing is, the way in which West Yorkshire works is we are very clear that diversity is a strength for us. And we are probably one of the most diverse boards there is. If you compare them to other integrated care boards, I think we compare favourably. I'm not saying there's not more work for us to do. Of course not. I wouldn't be the inclusivity champion if there wasn't any work for us to do. But I think one of the things that we've tried to demonstrate is we're not having tokenistic representation on our board. We are appointing people based on their skills and their expertise, and their diversity for us is a strength in addition to those different attributes. I think the other thing that I'm really proud of in West Yorkshire is the way in which we recruit and select our staff. So we've created an inclusive recruitment toolkit based on our vision to have a much more inclusive leadership.
So apart from the let's say the top 3 tiers of management, or 4 tiers, how many more staff have you got within the organisation?
So I can't give you the numbers off the top of my head.
Roughly.
Well, if you look at the Workforce Race Equality Standard, depending on the ICB itself, I think we've got more work to do in that space when it comes to representation.
So because you have satellite offices in all the major towns, haven't you?
Yes.
So you've got one in Bradford, in Huddersfield, I presume, in Leeds, in Halifax, right, and Wakefield. So you'll have satellite offices there. So these offices are people who work for the ICB itself. Okay. So I just wanted to see whether in those offices, people who work within those offices, are they reflective of the communities that they are serving?
Absolutely. There's more we can do because we've got an average of around about 20% of our population is ethnically diverse. I think that's increased now since the last census. We're not at 20% as a whole organisation, But we have got a really great diverse range of people working in our organisations, and we're doing more work to get them as well.
Because we talked about the funding crisis, for example. So are you still in a situation where you are actually proactively looking for staff, or are you fully recruited at the moment, so you've got to, you don't need to look for staff? If you are looking for staff, where are you advertising? How are you advertising so people can find those jobs, for example?
So there will always be opportunities, even in a situation where there are financial challenges. When it comes to recruiting staff, we are very, very clear about the importance of diversity being part of our organisation, and that the process we use to recruit our staff being as inclusive as possible. So we try and work with partners to advertise in spaces that we wouldn't normally advertise, to make sure that people that wouldn't think of coming to work in the NHS see those job adverts and we get the best candidate possible. Because it isn't just about attracting diversity, it's about attracting talent. It's the positive angle that I'm particularly passionate about. The other thing we try and do is the process by which we appoint that person needs to be inclusive. So sometimes people don't perform well in an interview situation. It doesn't always demonstrate the attributes of what the person brings. It's just about whether they're very good at talking. So what we try and do in those processes, especially when not from an ethnicity perspective, but from a neurodiversity perspective, we try and think really carefully about what are the specific needs of that candidate for them to show their best in that interview process. So we can get not only the best candidate for the job, but they show themselves in their best light.
Positive promotion and positive recruitment. In that sense, do you do any of that then?
So in regards to positive action, the process that we use is positive action, and we always try where we can to be really about our commitment to inclusive representation, and that we're seeking diverse talent.
So if people are looking for a job, would they find that information on the website then?
Well, no, because we want it to go to where people are. So we're trying to get the information out there. So if there is a job available, we don't want to just post it on a website. We want to post it everywhere, on TikTok, on Instagram, on your X, on people's WhatsApps, trying to reach people, because it's for us to find the best talent possible, as well as the people that are looking for jobs too.
Well, as I say, I mean, I'm not on social media, as a lot of people will tell you that, and not on social media.
Then we need to find another way to get to you.
I have no intention of, although supposedly I am on Facebook, but I have not used it at all. But so somebody like me, who may have a son or a daughter or a granddaughter or something like that, who is maybe looking for a job, how would you target me so that I get to know that there's vacancies here, so I can tell them about it?
Networks.
Right.
So you and I know each other via various people. So you start making some noise and go, I've got a job coming up, I'm looking for somebody with this kind of skill, do you know somebody? Because what I've learned on my journey as a leader is sometimes it's not what you know, it's who you know. So it's spreading the message, passing it on WhatsApp. You're on WhatsApp, aren't you, Baijan?
Yes.
Yes. So if I got it to you via WhatsApp, then that's a win. But there's also, for example, other mechanisms where email distribution lists, leaflets, there's a variety of ways. But for us, what we've learnt on our journey in health and care is not one size fits all, but we've got to be proactive about looking for people. We can't expect people to come to us. And we've got to also make ourselves attractive for people to want to come and work with us, which is why we see diversity as such a strength. For us, it's not an if or an and, it's the be all and end all.
I mean, if you look at West Yorkshire compared to North Yorkshire, obviously the richness of the diversity of West Yorkshire in terms of the population from this Asian subcontinent and the African Caribbean communities is quite substantial. So, in Leeds, for example, we have very substantial African Caribbean community. Bradford's got a very large Pakistani Muslim community, right? And Batley and Dewsbury also has got a large Pakistani Gujarati community. So, there's that rich diversity there. I think the question is, and this is something that people have raised with us before, that people feel that some of these institutions are blocked to a certain extent, that there's some sort of a ceiling there, that you can't penetrate, get beyond the doors. Now you saying obviously that you're trying to do whatever you can. Now if
not just me.
Well, I mean, you are the diversity equality champion, so you're trying to make sure that those communities have access to jobs and services. So we talked about the service side of it. I know that the Mid Yorkshire Hospital NHS Trust, for example, they're proactively looking at how they can sort of inform the community of some of the jobs which are open to them, available, to them. But they're looking at doing that, in various different ways. So I live in Batley and Dewsbury. We have this magazine called Pegam, which is, I think it's 20,000 circulation. It was a hard copy, but it's now gone digital. Now, I don't know whether your organization is aware of that publication.
No, let's have a chat about it though.
There might be, there are 2 publications in Bradford, for example, the Asian Express and the Asian Sunday. I don't know whether you have any interaction with those people.
A little bit, but not as much as we'd like. I mean, I think what you're trying to say, and it's quite right, is that sometimes people living in the grassroots of West Yorkshire think these organisations are organisations that they can't access, engage with or work for. The fact that I exist shows that's not true. So, my grandfather
I'm sorry, Fatima. I'm sorry, Fatima. I was head of equality and diversity for a very large organisation. Littlewoods, I don't know whether you're too young, you might not remember the Littlewoods catalogue. Littlewoods, like Grattan used to be in Bradford, was a massive organisation based in Liverpool. And I'm going back to the 70s. They were the first business organisation that actually employed an equality diversity manager. But when he looked at their organisation, yes, they had that person, and they ticked the boxes. Now, we know the public services has been absolutely brilliant at ticking boxes, but reality has been completely different. I mean, if you look at Bradford Council, and I've said this to the leader of Bradford Council, to Kirklees Council, you look at the senior management team, right, and you hardly see, when I'm talking about the senior management, I'm talking about the directors and the strategic directors. In front of Bradford doesn't have anybody, for example. And the population of Bradford is huge compared to other areas. So we've heard this before, and I've lived it. So what I'm saying to you, I understand what you're saying, but are you able, can you really feel that you are making a difference?
Yes. And, right? The reason for that, if you let me finish the point I was trying to make, which was the fact that I am a senior member of an organisation that has led a number of initiatives that have demonstrated impact and meaningful change shows that West Yorkshire Integrated Care Board doesn't just talk about it, it acts on it. So when we were aspiring to have a more inclusive leadership, we changed our recruitment selection process. We created a talent and fellowship programme which delivered over 80% of people into senior leadership positions. We created the first region-wide Root Out Racism programme that got over 600 organisations to sign up for it. Right. So when I say that we're not just talking about it, we're doing stuff that delivers. Yes, it takes time, and I can't speak for the other organisations that you're alluding to, but what we're trying to do is create a coalition or a movement of the willing to show people that actually you can do it, and when you do it, it delivers positive outcomes.
I am the advocate of something that I fundamentally believe in everything you say. The leadership is the key.
I agree.
To this subject. I'll give you an example. One of the smallest black and ethnic minority population in West Yorkshire is Wakefield. 2%. Yet there was a time in Wakefield when out of the 13 chief officers and unit heads, 3 were of colour. No other local authority, including the big boroughs in London, could match that record. And that was because of the leadership that was there at that time. So I agree with you. Now, are you sure that your leaders and yourself, who's part of that team, and I'm sure they are committed to it, but in terms of actually action and delivery on the ground, I'm sure people will be watching this saying, okay, I've got a son or a daughter and I want them the door to open for them, right? How do we make sure that what you're trying to do from the top permeates down to the bottom?
I think that's a really good question, and there's sort of a couple of parts to that. The first thing is, the mantra that I've always worked on is it's not down to the people that experience injustice to lead the corrective action. So although my job is to be the inclusivity champion, I am part of a network of leaders working on this agenda. Right. I can't cover all of the HR, I can't cover all the different levels of leadership within an organisation. We need a network of people supporting to make this happen. Our allies are our leaders. So one of the things that is really important to me as a champion is to make sure that the allies are using their privilege to influence change. And if you look at some of the leadership around the table of West Yorkshire ICB, they've got a track record of inclusive leadership and action supporting that.
Yeah.
But the other thing that you say is that you can have the best policies in the world, but they're only as good as the person implementing the policies.
Yes,
so to get that in the grassroots of an organisation, we've got to develop that capability, that expertise of people at all levels, delivering inclusive leadership. Because people don't always work for just the organisation title, they work for the line manager. And if the line manager is not a supportive line manager that understands and supports you and enables you to fulfil your potential, you're not going to want to work there. But we want to be an organisation where you want to come and work for us and you want to stay. So we haven't got it all right, but at least we're trying and we're making good headroads and we've got a credible track record. But I completely agree that there's always more we could do.
I'm really glad to hear that, and I'm sure you're doing everything you can to try and make that happen, and that is something that is absolutely vital as we move forward, because we've got a lot of young people who've got huge talent.
Absolutely.
Right, who are not getting the opportunities
No.
that they should be getting. So I'm really glad to hear that, and I'm sure there'll be parents out there who'll be watching this, hearing you, and they'll be very grateful to hear what you've said. So if you have a son, daughter, granddaughter, grandson, or somebody in your family who has got all the qualifications, but they're not finding the opportunities out there, you may want to seek out the Integrated Care Board's sort of 5 district offices and see if there's any opportunities out there. I'm sure, as Fatima says, the organisation will do whatever they can to try and make sure that they are looked after and that they provide the opportunity, providing they meet the minimum criteria. As long as they do that, I'm sure they'll get a fair chance of finding a job within this organisation. Now, in terms of service input, obviously we didn't get a chance to talk about it. How can people influence the shape of the services that you deliver? You're running out of time. Now, do you have a sort of a network of people that you talk to? Yeah,
we've got a whole Your Voice network here in West Yorkshire. But I started my journey as a patient public carer champion. So I'm not your usual healthcare executive. My journey was very much about trying to make services better and working with healthcare leaders to make services work for my loved ones and for me. So you can join our Health Watch network, which is an organisation in the VCSE that supports people with lived experience that want to make services better. That's the one in the
community sector?
Yes, in the community sector. Or you can join our Your Voice within West Yorkshire as well. You can also come to our meetings and ask us questions. So in the Integrated Care Board, we meet in public. People ask us questions all the time.
And do you meet around the county, or do you meet
Yeah, we move around West Yorkshire.
Okay.
So we meet in different parts of the region. You can come in person, you can watch online as well. Please do watch them if you've not watched one before. And you can ask us questions. There's many different ways in which you can try and influence change. But equally, we need to make that as inclusive as possible. So if there's more ways in which we can do that, I'm always open to suggestions.
Right, okay. So there you are. You've heard it from, as they say, the horse's mouth. Fatima, I'm really grateful for you to come in. I mean, obviously, you carry a huge responsibility. And may Allah give you strength in discharging that responsibility. And we know for a fact that sometimes you may want to do things, but the institution or the organisation or legislation will not allow you to do so. But I hope today's discussion with Fatima has actually opened your eyes into this huge area of health that sometimes people are really unsure as to who does it, who provides it, where do you go for support and advice. And she says, we have a network now, we have people there like Fatima and others who want to make sure that our community's needs are actually understood and then addressed. Because unless you approach organizations, and particularly people like Fatima and those who work within the organization, they will not know how to shape the services, because unless people tell them what is required, they can't shape the services. Of course they can, because of experiences that Fatima brings, the lived experience she brings, but it might be different to the experience that you may have. So your needs, your services may be slightly different to what my needs would be or Fatima's would be. So it's important to get engaged with the ICB as much as you can, and particularly for young people, both in terms of service needs, particularly those who are caring for people within their families. It's important The working carer's passport is something that I've heard of before but wasn't aware of. So thank you for sharing that as well. So if that is something that helps you, I hope it does. We'll be talking about health in future as well. Inshallah, I'll be with you soon. In the meantime, we're now going for the Eid and the Qurbani break, and I will see you soon. Take care. Assalamu alaikum wa rahmatullahi wa barakatuhu. In the meantime, we're entering the Hajj season, this very important time of our lives. Please make dua for all those who are going for Hajj and all those people who intend to go for Hajj and Umrah. May Allah keep all of them safe, us safe. Make dua for me and Fatima and all our families as well. Assalamu alaikum wa rahmatullahi wa barakatuh.